This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu and you're watching Health 54. A booster shot is the most effective protection against COVID-19 for those who have taken 2 shots of the Sinopharm vaccine, doctors said at the Arab Health Trade Exhibition in Dubai. Senior government hospital doctor says mixing of shots is highly effective. Dr. Gerhard Ghazali, led immunologist at the government-run Sheikh Khalifa Medical City in Abu Dhabi, reported a very strong response in the body's immune system once a double dose of the Sinopharm vaccine was topped up with a booster shot of the Pfizer-BioNTech vaccine. In Abu Dhabi, the Department of Health is also offering a 3rd dose of the Sinopharm vaccine for those who had a 2nd dose 6 months ago. The Indian government said Wednesday that it was closely monitoring Delta Plus, also known as AY.1, which is the Delta variant of the coronavirus, but with an extra mutation. The original Delta variant is about 60% more infectious than the Alpha variant, the most common version of the virus in the US, and has now spread to at least 75 countries. And following the surge in cholera cases in Nigeria, the Nigeria Center for Disease Control has moved to activate a multi-sectoral national cholera emergency operations center so as to tackle the outbreak of the disease in the country. So far, Nigeria has reported 10,833 suspected cholera cases in 2021. According to a statement from the Nigeria Center for Disease Control and signed by its Director General, Dr. Chikwe Ihekwazu, the agency confirmed 112 new cases of cholera and no fewer than 289 people have so far lost their lives to the disease. And around 40 cases of the Delta Plus variant, classified as a variant of concern, have been detected sporadically in Maharashtra, Kerala and Madhya Pradesh, the Union Health Minister said on Wednesday, after the report of AY.1 by the Public Health England on June 11. Retrospective analysis of samples reviewed the first occurrence of this lineage from a sample collected from Maharashtra. The sample was collected on April 5. As of June 18, 205 sequences of A1.1 lineage was detected worldwide, with the USA and the UK having over half of the unknown cases, the statements reviewed. And health experts have called on parents to encourage their children to know their genotype before getting into relationships. This, according to the director of Bentolin International Health Concept, Ogunleye Tolulope, is to reduce the increasing number of persons living with sickle cell disorder and break the cycle of raising children with the disease. This is TOS Television, your digital first Pan-African News Network. You're watching Health 54. More stories after this timeout. Welcome back. You're watching Health 54 on TOS Television Network. Studies have shown the majority of people infected with COVID-19 develop a strong T-cell response, which bodes well for potential long-term immunity against the virus. But that is far from certain. Professor Al-Ramadi said asymptomatic or mild cases of the disease triggered a stronger T-cell response in patients when compared with those with moderate or severe symptoms. A scarcity of T-cell was also reported in older people and those who became ill with COVID-19. And an Ebola outbreak in Guinea that started in February, infecting 16 people and killing 12, has been declared over by the World Health Organization. Health authorities were able to move swiftly to tackle the resurgence of the virus, which causes severe bleeding and organ failure, and is spread through contact with body fluids after lessons learned from previous outbreaks in Guinea and the Democratic Republic of the Congo. The federal government on Wednesday launched the National Domestic Resource Mobilization and Sustainability Strategy to reduce the country's over-dependence on international donors to fund HIV and AIDS interventions and responses. Currently, 80% of funding for HIV comes from international donors and development partners, while the government only contributes a paltry 18% of the funding. Stakeholders have therefore advocated an increase in the level of domestic funding for HIV responses across the country, which will place the country in a safe position should foreign donors decide to withdraw their funding. And South Africa's health regulator said it had received documentation for China's Sinopharm COVID-19 vaccine and will evaluate the data to assess the efficacy of the shot. Now in the grip of a third wave of infections, South Africa is inoculating its population with Johnson & Johnson and Pfizer vaccines, but the rollout has been slow, partly due to setbacks in supply. It has vaccinated just over 2 million people, a representation of 3.6% of its population, one of the world's lowest rates. Authorities have faced pressure from South African radical opposition party, the Economic Freedom Fighters, to authorize the use of Russian and Chinese vaccines to ramp up vaccinations. And Monash University researchers have developed a fast, cheap paper test that can detect bilirubin in jaundiced newborns. The tape paper sensor is on the verge of extensive clinical trials. The in-home test aims to detect bilirubin levels and could provide results in less than 10 minutes. More than 60% of newborns experience jaundice within 15 days of birth. A percentage of these jaundiced babies require hospital admission for a period of phototherapy. And that is Health 54 right here on your Digital First Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.